Hi, everybody. I am Diana Pena-Gonzalez, the Health Literacy Education Director at IHA. Welcome to day 2 of the 21st Annual Health Literacy Conference. Just to recap a little bit from yesterday, we focused on communication and we explored some challenges we've been facing as a health literacy community. Today's general topic is nurturing our resilience. As we continue to focus on health literacy, we realize more and more how much our work is relied on by our health literacy, by our communities, for access to clear and honest information, for guidance and support, and for access to care. To continue doing our great work, we must also take care of ourselves. So today is devoted to that very idea, taking a pause to reflect and rejuvenate for our work ahead. So let's jump right in with some housekeeping items. So for questions, you can visit the virtual help desk that's found on the homepage. For continuing education, take a look at the CE information tab that's on the left-hand side of the homepage for specific information on each provider, and so you can successfully get the CEs that you're looking for. And also, you can find all the evaluations, including session evaluations and overall evaluations, by visiting that evaluations tab. So all live sessions today are going to be recorded and they'll be made available on the platform within 24 hours. So speaking of which, if you missed any of the program yesterday, you can also check back on the homepage and see yesterday's items, and you can watch everything that maybe sessions that you've missed yesterday. They're all there and ready for you. So some information about this session is that you guys were all going to be muted, but we are, and we'll be taking questions at the very end of the session, but we do encourage participation. So there's a questions tab. For all the questions that you want to send to the presenter, type them into that questions tab. And there's also the ability for you to, there's a vote button. So if there's a question that you like, or you have the same question, just hit that vote button and it'll give points to that question. And the more points a question has, the higher up in the queue that question will appear, and the more likely it is that the presenter will answer that question. And there's also a discussion tab. So we encourage you guys to throw in your comments and your thoughts in there and share with one another in the discussion tab. And again, for all questions that you have for the presenter, put those in the questions tab. With that, I would like to turn it over to our moderator for today. We have 2 great presentations today that I'm really excited for you guys, or 2 great speakers in this plenary that I'm excited for. And so Terry Ann Parnell will be moderating those 2 speakers. She is the principal and founder of Top Wellness Coaching and Health Literacy Partners. She's an award-winning author and frequent speaker on health literacy, cultural competency, and patient education. Dr. Parnell will also be speaking tomorrow on a panel, which I highly encourage you guys to attend. It's going to be a great panel tomorrow morning. And she's going to be talking about her new venture, Top Wellness Coaching. So I'd like to turn it over to our moderator for this session, Terry Ann Parnell. Welcome, Terry.
Thank you, Diana. Welcome, everybody. So I'm going to jump right in. It's my great pleasure to introduce Dr. Michelle Roberts. Michelle Roberts is the founder and clinical director of the Relational Trauma Recovery Center with offices in St. Louis, Missouri and Portland, Oregon, where she practices EMDR, attachment-focused therapy, and other evidence-based trauma models. She's nationally certified counselor, licensed in Missouri and Oregon, and a member of the EMDR Disaster Network. Dr. Roberts currently holds a doctorate in clinical mental health counseling at the University of Missouri. And prior to her clinical work, she was a Pulitzer Prize-winning journalist covering mental health and later a founding director of Health Literacy Media. Her work has been recognized by the Annie E. Casey Foundation, the National Mental Health Association, and the National Alliance on Mental Illness. She's served as a member on the board of Reach Institute and as a Rosalind Carter Mental Health Journalism Fellow at the Carter Center in Atlanta. Roberts is the author of the Institute for Healthcare Advancement's publication, How to Manage Your Anxiety During COVID-19. Michelle?
Hi, good morning. Thanks for the introduction. So I wish I could see everyone today. This morning, I'm reminded of how much I miss that annual trip every May to Irvine to the in-person IHA conference. It almost seems like a lifetime ago. When the planning committee asked me to speak this morning, we talked about how I could address the topic of what myself and others are calling the shadow pandemic. That's the looming mental health crisis, not only among the general population, but more specifically among our nation's caregivers, health and mental health professionals. I remember chuckling when Michael Valere said, "Michelle, if you could just give everyone a virtual hug." As a trauma therapist who's been treating a full caseload from home since March of 2020, I can say that I am, if nothing else, a highly skilled virtual hug giver these days. So let's talk about what's going on out there. Quantitative research is starting to show us what we already know. The pandemic has overwhelmed our healthcare system and the professionals who keep it running. Not only were they performing life-saving acts every day, but they also carried the psychological pressure of the hero narrative, right? Fulfilling this idea of someone strong, tireless, fearless, and who ultimately prevails. For more than 2 years, they've confronted patient deaths and faced uncertainty about their own safety and the safety of their loved ones. They bore witness to the emotional trauma of others with little opportunity, much less time to process their own. Mental health or healthcare workers believed vaccines would ease the traumas endured in these initial surges, but plateauing vaccination rates, lifted mask mandates, and the Delta variant really undid a lot of those hopes. So this unrealized promise of some sort of normalcy has made the feelings of exhaustion and frustration worse. And as you know, we're heading into yet another mode of feeling like we've got another hill to climb with the new surge that's happening. Healthcare professionals are also telling us that COVID-19 patients might be more difficult to deal with now. Currently, most of them are unvaccinated, and while some didn't have a choice in the matter, those who did are often belligerent. Some resist basic medical procedures, while others have assaulted nurses and yelled for treatments the FDA hasn't authorized for COVID-19 treatment. That's the reality of what's happening. Why do I bring this up? Because these experiences inflict deep psychological scars in our healthcare workforce. Our professionals want to be rooting for their patients, but many now report that they're becoming detached, no longer shaken by a patient death, but unmoved. Classic symptoms of post-traumatic stress disorder. Add to that bone-crushing fatigue. Hospitals are flooded by non-COVID patients who delayed care amid the pandemic and now require more intensive care, which means that there never seems to be a reprieve between surges. So a report out last week details in very stark terms the economic, mental, and physical health toll of American healthcare workers. This report was by HHS. It found that much of the workforce is struggling with burnout, anxiety, and trauma, and they want to leave the profession. Between March and April 2020, the healthcare industry lost 1.5 million workers, exacerbating healthcare workforce challenges and staffing shortages. In a completely separate study, 32% of registered nurses surveyed in the US said they were considering leaving their roles. Think about that in the context of when we used to go to the health literacy conference, and we confronted all of the challenges that were in place then. Now, look at how those have mushroomed. Healthcare workers aren't exiting the field because they can't handle their jobs. They're quitting because they can't handle being unable to do their jobs. Many say they've left medicine because of how their institutions acted amid the pandemic. Hospitals cut salaries, we know, benefits and raises. Staff had to work more shifts, being denied paid time off or reduced hours. They failed to provide sufficient protective equipment. And often the severity of Clinicians' psychological and real experiences were downplayed. So let's shift over to the mental health system. The pandemic has caused more than 2 years of collective trauma, and many people are near a breaking point. This has created similar pressure on our nation's therapists. It's been difficult to find counseling in much of the United States for years, long before the pandemic began, but now, after more than 2 years of unrelenting stress, turmoil, and grief, many people seeking help are confronting a system at or beyond capacity. Over 500,000 people reported depression and or anxiety between January and September of 2020, with screenings for anxiety and depression up 634% and 873% respectively, according to the Mental Health Association. 4 in 10 adults reported anxiety or depression since March 2020, up from 1 in 10, so that's 4 times more, who reported the same symptoms from January to June of 2019, pre-COVID. Talkspace, which is an online counseling agency, reported a 65% jump in clients since mid-February of 2020. And the demand for virtual therapy and psychiatry is up 302% compared to averages reported pre-COVID. We know that it's next to impossible to find specialized care for kids, for those with lower income. Assistance of any kind is in short supply in rural areas. Those hoping to find Black or Latino therapists face even more limited options. While all those circumstances have been true for a long time, the pandemic has made it significantly worse. Frankly, I've never seen it this bad. A recent New York Times survey was administered through Psychology Today, and 9 out of 10 therapists say the number of clients seeking care is on the rise, and most are experiencing a significant surge in calls for appointments, longer waiting lists, and difficulty meeting patient demand. My own wait is now reaching into the 8-month mark, and I have a highly specialized practice. Where's this higher demand coming from besides the obvious? It is new clients seeking therapy for the first time for anxiety, financial stress, substance abuse, job worries, and other issues that have surfaced during the upheaval of the past 18 months. Many therapists say they're counseling healthcare workers who have been traumatized by caring for COVID-19 patients. More than 60% of my own practice is comprised of medical doctors and other therapists seeking trauma care. Kids are struggling. About 13% of the New York Times survey respondents said their practice is focused primarily on children and adolescents. Their responses echoed a recent advisory from the US Surgeon General, who warned that the pandemic had intensified mental health issues among the young. We even know that couples are struggling. Couples are arguing more and coping with the after effects of lockdown, isolation, financial and job stress, and having children in online school. None of the presenting problems are necessarily new. It's just that people's capacity to have resilience and compassion, everyone is just so worn down. Substance abuse is also up. The federal government's mental health and substance abuse referral line fielded 833,000 calls in 2020, 27% more than in 2019 before the pandemic began. In 2021, the number rose again to 1.2 million. And on February 1st, a Senate committee held a hearing to address the nation's growing mental health and substance abuse problem. So although the New York Times survey did not ask about therapist burnout, we know that about 10% of respondents raised the issue on their own. Nearly 1 in 5 therapists surveyed reported having had to cut back hours because of home and life demands during the pandemic. 78% of psychiatrists self-reported burnout in 2020, 78% self-reported burnout. 16% of those psychiatrists themselves met the clinical diagnostic criteria for major depression in the same 2020 study. 90% of college counseling center practitioners self-reported burnout in 2020. So one quote was from a therapist in Chicago. One thing many people are failing to acknowledge is the impact of the pandemic has also had on therapists. Usually we're not dealing with the exact same thing in our personal lives as our clients are. So how to recognize burnout in ourselves? There's a few things that we look for. And these are really important for us to not only look for in ourselves as we provide care, but also to look for in other caregivers that we might work with. So many of us are isolated in our own private practices or home offices now, so this becomes more difficult. But these are the things to start thinking about. If we're feeling tired most of the time, if we have lowered immunity, frequent headaches, back pain, or muscle aches, a change in appetite or sleep habits. Emotional, this comes up in therapy a lot, self-doubt, feeling helpless and hopeless, detachment. We heard about that in one of the examples I mentioned earlier with hospital workers feeling more detached from the things that they witness every day, decreased motivation, an increasingly negative outlook, decreased satisfaction and a sense of accomplishment. Oops, next slide. Okay, and the next slide. In our behavior, we can look for withdrawing from responsibilities, isolation, procrastinating, using food, drugs, or alcohol to cope, taking our frustration out on others, even skipping work or coming in late or leaving early. Next slide. So what do we need to do to reduce burnout and become more psychologically resilient under the weight of all of this pressure? Some of these things seem really obvious. Some of them are obvious but hard to do in the current circumstances, but they're things that we must really set time aside for in our schedule to nurture, even sometimes when we don't feel like it. One of those is maintaining a social support network. It's much easier to be resilient to the challenges of work and life if you have a solid social support network. Talking about your feelings and having strong connections to your partner, family, friends, and work colleagues can help us to be more effective. It's really important to make this time, particularly for those of us who feel like every hour of our day is needed by a client or a patient. If we don't start setting aside time for ourselves very deliberately, we will not be able to keep the pace that we've been going. And this might be something that's really counterintuitive. I know a lot of therapists historically don't do things like take a month off at a time. Sometimes we have to start, especially now, have to start thinking about doing things that we normally wouldn't have done just to keep our resilience high. So 2 weeks might not be enough to restore, but a month might be more helpful. So considering things, taking even more time off than you normally would. Here's another one that might be a little counterintuitive, taking care of others. And this is outside the work context. Humans, animals, plants even. I've noticed there's a real surge resurgence of people taking on plant keeping. For me, it's a flock of backyard chickens. So it's important for us to not turn away from who we fundamentally are. Those of us in healthcare and mental health are at our core caregivers. So while we have all of that structure of the job that we sometimes feel disconnected from, it's really important to find an area where caregiving is still just pleasurable, right? Because we know that taking care of other living things reduces stress hormones in our own body. It protects our heart and strengthens our immune system. So during tough times, showing these little simple ways of caregiving is a win-win situation. Another thing that we can do is maintain a third place. So many of us have, when we work, intense jobs, have homework. And the pandemic has really robbed us of other places. We don't go out to the store as much, or we don't socialize as much. But this third place should be in addition to your home and your workplace. It should be a physical environment where you can go to relax, socialize, or engage in an interest or hobby. And when we're under pressure, we have this natural tendency to spend too much time at work or home. But it's important to keep spending time in our third place. During COVID days, my third place has been an outdoor dog park where I can see people in my community and catch up with them, but we're still outside. Another thing we should do is know our early signs of stress. So as stated earlier, some of the ways to recognize burnout, really get to know what your early signs of stress are. For me, it's I will start drinking too much Diet Coke again, something I'm always trying to get, a habit I'm always trying to shed. If I start picking that up again, I know that I am a little bit unbalanced and I need to really get back to my healthy habits. For everyone, it's different. A lot of people pick up smoking again, or secret smoking, or whatever the case may be. Be aware of what those early signs are, and then take action for that. Physical exercise, make time for movement, schedule it in. I mean, so many of our lives have been reduced to these little slots on the calendar. Make several of those slots every week devoted to physical exercise. We know that this works for not only your physical health, but so much for your mental health. A recent study of 1.2 million people found who had an average of 3.4 days of poor mental health per person in the past month found that number dropped in half when they exercised. So, I mean, that is just one of the simplest things that you can do. And then deep breathing. This is one of the easiest relaxation techniques to master. And it's also one of the most effective in helping you remain calm and resilient. Slow, deep breathing from the diaphragm slows down your heart rate, lowers your blood pressure, and reduces tension in the muscles. And then tip 10 is just like resilient thinking. One exercise I like to do with my clients, and I even use it when I need it, is something that just subtly shifts the tension in the nervous system. I call it the Holy Trinities. You sit there and you say out loud 3 brags about yourself. I'm a really good cook. I take good care of the dogs. Whatever the case may be. Then 3 gratitudes, and then 3 desires. Just that subtle shift in thinking in this new way calms down the nervous system. So often, like I said, it's doing seemingly very simple things that when you get into the habit of it can make a very big difference in offsetting a lot of the stress and trauma that we've all been under in the last couple of years. So I want to open it up for questions or thoughts, or even some more suggestions for things that we can do to feel better.
Well, thank you very much, Michelle. That was a great presentation. I learned a lot. We do have a bunch of questions. So I'll start with Kelly, who did ask, considering your clients are so traumatized, how, do you prevent and cope with your own burnout or, compassion fatigue?
Thank you for asking. I have my own therapist who helps me with this. I always say, if your therapist doesn't have a therapist, get a new therapist. If only it wasn't so hard to find a therapist right now. But what I do to deal with it is I have changed my schedule. And this is not something that I've always been very energetic, and I've always been able to manage, a full caseload without really feeling too stressed about it. Mm-hmm. However, clients now are coming in stressed by COVID. But what that does is that activates all their previous trauma as well. So people are coming in, at least in my practice, very dysregulated. And what that means is, even though I can manage that in practice, it does take a lot more of my energy. So what have I done? I have refashioned my own schedule so that I work in short bursts. I work 3 days, 1 week, then I'm off for 6 days. Then I work 4 days. Then I'm off for a couple days. Then I make it so that I have at least 2 6-day periods off a month. Okay. That's made a big difference. And guess what? By changing my schedule, I'm not seeing a whole lot fewer clients. I'm just changing when I see them, right, so that I have more time to recharge.
Okay, great. Thank you. Mm-hmm. So I think we have time for 1, maybe 2 more questions, depending upon the response. I know there's a few in here, but let's see. So many professionals are trauma informed, less seem trauma competent. Many are newer to trauma therapy, including EMDR. What are good questions to ask or things to keep in mind when searching for a trauma competent therapist? It's a great question.
Yeah, it really is. And honestly, that begs a longer answer than I'm going to be able to give here. What I would say is there is a huge difference between someone who is EMDR trained and somebody who treats a complex trauma. And a complex trauma is a trauma that usually begins in childhood and is complicated by events throughout the lifespan. And these are usually relational in nature, right? They have to do with abuse, neglect, marriages, relationship patterns. And when you add something like a pandemic on top of that, this trauma becomes very complex. And a therapist who is not trained in complex trauma and has significant experience in complex trauma, you can run the risk of that therapist basically putting someone outside of their window of tolerance. Mm-hmm. And so you have to be very careful that you select someone who has a high level of skill in complex trauma.
Okay. And I think we have like 2 minutes left. We have a question. What are ways we can raise awareness for or address pandemic fatigue?
I think just start talking about it as though it is a real legitimate thing. I have started inserting this into conversations with clients and friends, my children, my sisters. When I hear them talking about things that they are having trouble pulling off or doing that normally would have been a snap, I don't invalidate what their experience, but I say, and this is probably a lot harder because we're all so tired because of what's been happening. So I look for a way to just kind of introduce that idea wherever I can, because I believe, if we're upset or having issues at, let's say, a level 4 out of 10, we can automatically add 3 points to that because of the pandemic. So what would have felt like a 4 is going to feel like a 7.
No, and I think speaking about it, you know, more openly and regularly encourages people to, you know, share more and get help. So thank you for that.
Yeah.
So I think we're out of time. So thank you very, very much for that insightful presentation.
Thank you so much. Bye.